Hello, and I'm absolutely delighted to welcome Professor Norma Correa from Peru today, who is going to discuss some of the issues around children and schooling. Norma, would you like to, or Professor Correa, would you like to introduce yourself and tell us what you do in your work?
Well, thank you very much for the interview. My name is Norma Correa. I am based in Lima, Peru. I work as a professor and researcher at the Department of Social Sciences at Pontificia Universidad Católica, which is a private university. I'm also a mother of two young girls. During COVID years, I got involved in advocacy for school reopenings here in Peru. I work on poverty and inequality, and as a social policy specialist, I've worked for many years on assessing the impact of social protection programs in vulnerable populations in Peru, in rural and urban areas. I have also had experience across Latin America. And during COVID years, I was able to follow on the impacts on specific policies regarding the attention to vulnerable groups, in particular population that are recipients of social programs, indigenous peoples. And after that, I got involved into the educational debate. But to be honest, that was with a different hat. I mean, what I've done, in topics related to poverty, inequality, economic and social development was with my social anthropologist research hat. What I did on the educational front was with my mother hat. And it was because in Peru, we had one of the longest lockdowns in the region. And the impacts on education, and in particular in children, were evident.
The schools were closed for 2 years, is that right?
Yes. I mean, Peru faced one of the longest and really hardcore lockdowns. We did have an awful toll. The pandemic hit us very hard in terms of the number of people, that got disease, and also the major economic impact. I mean, just to give you an idea, in terms of our poverty evolution, the consequence of the first year of the pandemic was that poverty actually increased in almost 10%. We were around 20 points, percentage points on poverty just before the pandemic hit, and a year after, we were around 30%. That meant
30% of the population was defined as in poverty. Is that what you mean?
Exactly, under poverty line. And I mean, just to be very clear about it, the first year of the pandemic implied that we lost a decade in all the advances we did in poverty reduction in Peru. So you had a third of the population under poverty line. The economic impacts, the social impacts were severe. And in particular, this is a country with high levels of informality. It's around 73% of the general population in Peru has informal jobs. That means that they depend on daily wages. They don't have any social protection system. Therefore, lockdowns were terrible for this population.
Yeah. But just to talk about why that poverty was increased, it was because of the nature of people's work. So they had no income. Is that correct?
Yeah, it was a direct consequence of the economic lockdown.
Yeah.
You had, in particular, urban areas were severely hit. And you had, closure of the main economic activities, and this was very hard for small entrepreneurs, for people that also lost their employment because some companies couldn't survive the economic hit. And that's why we got that important increase in our poverty figures. Of course, rural areas were also affected.
Was there a furlough scheme, any payment from government to any businesses or people to take them through that period of lockdown? What was the help and support like?
Yeah, well, as it happened in other Latin American countries, the Peruvian government applied cash transfers. We had a couple of programs that support families, and there was also a financing scheme for companies. But regardless of that, the impact was tremendous.
And is that because not everyone was eligible for these government schemes, or why?
Well, basically, if we look at a population that were already poor before the pandemic, this population was already identified in the public registers. They were already beneficiaries of cash transfers. So these people were on the database. The problem was people that were highly vulnerable before the pandemic, and after the lockdowns, they fell into poverty. These people was out of the radar. So it took a long time, for the government to identify these people.
They were off the radar, off the government radar. Why? Is that because they were not in? Is that because they were informal in these informal employment? So can you give me some examples of that?
For example, people working on transportation in the transport services, either informal services or formal services. Little buses bringing people from one point or another. I mean, the cities were locked down. So a lot of people working in this sector, they couldn't go to work. Just to give you an example, markets were working, but they had to, retrain themselves. But for example, the case of people working in transport is very evident on how hard it was, for families that were dependent on daily incomes. Another example that happened here, and I know similar situations happen in places like India, is that you had, for example, migrant workers, people that came from rural areas to the big cities, to work as a seasonal employment. And here in Peru, our summertime goes from January to March, April. So when the pandemic hit, we were, ending the summer, typical time when these people that do seasonal work, they, might decide to stay or go back. When the pandemic hit, being such strict lockdowns, you had these terrifying images of people leaving the city, buy food, and going back to their home towns, buy food, because they couldn't sustain themselves in the city. There was no way for these people to earn a living. So they had to go back by feet to the highlands, to the Amazon. Why did this happen? Most of these people were seasonal migrants. They couldn't sustain themselves in a city where they couldn't work. So they had to go back to their hometowns. Another figure is the ones that stayed in the city. And in this a big group, you have people like me, for example, people that, we have a regular employment. We had the possibility of doing remote work. We face some challenges, but very, minor if you compare to the reality of the majority of people that did not have any permanent wages, and they were basically on survival mode. And that's why, for example, we had a response from civil society named ollas comunes, which is a sort of, I think in English you call them kitchen soups, people, in shanty towns getting organized, cooking together. That was the only way for these people to afford some meal. And it was, I think, a great example on how, despite how hardcore lockdowns were, civil society kind of found a solution, not an ideal one, of course, but a response to, solve a problem with much more speed that the public policy actually did.
And can you describe what the streets were like, how the lockdown was policed. Some examples. I think the details that you have are things that, we don't really know about. We knew that, there was a hard lockdown in Peru. We just get the figures, the death figures, this, that, and the other figures, the bigger picture. But just describing the day-to-day life and we'll move on to children soon, but just for people, what was it like and how was it managed?
We had the military out in the streets, not only the regular police, but also the military. This country was ruled under a state of exemption for more than 2 years. All the powers were given to the executive. In the midst, we had a lot of political turmoil. But what I would like to highlight is the fact that you had a country, in particular in the urban areas, that were severely controlled by military force and police forces. And for example, Lima is in front of the Pacific Ocean. So, for example, you were not allowed to go to the beach. You were not allowed to go to the parks for the good part of 2020. For example, children were not allowed to go to parks until at some point, I think it was September 2020.
So literally locked in your house, not allowed to meet, not allowed to go to the park. Just allow. What do you remember? I know rules were changing, but at the hardest point in that beginning 2020, you were only allowed to get food. Is that right? And
yes.
Essential travel. That was it.
Essential travel later. Just for essential workers, it was very hard to move. You need to have a special permit, a special pass. And yes, of course, rules were changing over time, but I would say that until November 2020, the situation, the whole city of Lima and also other capitals in Peru were severely locked down. The situation in rural areas was mixed, in part because of the capacity of the state to police in rural areas was lower, but that of course had a consequence. For example, the expansion of illegal economies in the Amazon and was, in a way facilitated by the fact that you had a lot of, police, military forces preventing people in the cities, of doing awful things like going to a park and going to the ocean instead of, policing what they actually had to do. In other areas, for example, the expansion of drug dealing or illegal mining in the Amazon, So, the reality from people in rural areas was also difficult, They had, for example, one major implication was that, the medical response to lockdowns and to the COVID emergency was, to focus resources at the hospital level. And the network of hospitals in Peru, as you may imagine, has a lot of gaps, among the territory. So, if you focus resources at hospitals, you are focusing basically on big cities, So what happened for people in rural areas, the local health facilities did not open doors, did not have the personnel, did not have the resources. So it was also very hard for people in rural areas to access to basic health services.
Do we know, or is there any research on the ramifications of that, the results of that? Did people not get the healthcare they needed, and were things missed?
Yeah, the Ministry of Health, they have data, for example, on the impact on children's vaccination, the basic package, how this affected, the access to regular vaccinations. And another thing that I think it's important to highlight is that, and this not only happened to health, it also happened to other public services. The official response by the government was to make these services remote, and when they, provide remote health services, as you may imagine, there were a lot of problems in terms of connectivity and the capacity of people to access to those services, So, okay, regardless of the fact that the health facilities did not have the resources, were understaffed, the solution that was provided, which was remote provision, did not work for everyone.
No. So by remote services, you mean that people would have a telephone call or a video call, and they would be diagnosed in that way, which is obviously not, you can't do a proper diagnosis like that. When you, during those periods, was there a heavy police and military presence on the street? Were there people trying to get round it and meet up anyway, or were most people too frightened to really break the rules?
Well, I mean, you had situations in the media, people being taken to the police station because they broke the rules, which was, I mean, depending at which time of the year it was when you left your place at the wrong time, when you took your dog to a walk at the wrong time, or if you were a surfer and you went surfing to the Pacific Ocean. I mean, you could face that too. And I remember, I mean, if you let me throw a personal story, it was back
Yes,
in
please.
back on December 2020. And I, with my family, we were able to rent a place outside Lima, and in a beach town, in order to get some fresh air. Had two small girls back then, and I clearly remember the image of my youngest daughter, which back then, I mean, she was just 7. She was walking with me by the beach, and she jumped into the sand because she wanted to touch the ocean. And then out of the blue, we had like 3 motorcycles with the local police, shouting and tell us, "Don't do it, don't do it, don't do it," So,
Unbelievable.
when that happened, I was like, oh my God, I mean, this is
Terrible.
some sort of, tragic,
Awful.
tragic nonsense. And
Yeah.
again, a total misuse of public resources.
Yeah, absolutely awful.